Hi, hi everyone. My name's Trish. First up, I am not an occupational hygienist, but I am an occupational health advisor. Now, in this session today, I'm going to be talking about zoonoses. So I'll provide an introduction to zoonoses. Then I'll look at the main ways that zoonoses spread, and I'll provide an example of a zoonosis to illustrate each of these ways of spreading. Now, I'm a bit of a zoonoses nerd, so I could talk about zoonoses for hours, but I'll limit myself and you to just 3 examples of zoonoses, one for each mode of transmission. And I'll also talk briefly to COVID-19 as originally as zoonotic disease. Now, with this session, I have provided a reading list. Just if you're interested in this topic, there's lots of links to other resources that you might be interested in reading. So first up, what are zoonoses? Well, these are infectious diseases of animals that can spread to humans. They're a really important group of communicable diseases because more than 75% of new human infections originate from animals, particularly wildlife. So recent emerging zoonoses in Australia have included Hendra virus and Australian bat lyssavirus. And emerging zoonoses overseas have included Ebola virus, Nipah virus, and that's very closely related to Australia's Hendra virus, and severe acute respiratory syndrome, or SARS, Middle East respiratory syndrome, or MERS, and COVID-19. And these last 3 are all caused by coronaviruses, and they've all originated in bats. So each animal species is associated with its own list of zoonoses. Some zoonoses only infect a small number of animal species. For example, ORF, which is also known as scabby mouth. This is a disease of sheep and goats and can cause a viral skin infection in humans. But other zoonoses, such as Q fever, can infect a much wider range of animal species. This slide here just provides some examples of zoonoses that infect different animal species. It's by no means an exhaustive list, and each of these animal species can be infected by other zoonoses. Many zoonoses have co-evolved with their relevant animal host over a long period of time, and they may not necessarily cause disease in the animal, and so the animal may present as asymptomatic, which is why it's so important that people always maintain good hygiene around all animals, whether they are healthy or sick. An example is STEC, or sugar toxin producing E. coli. This is commonly found in healthy livestock, but it rarely causes disease in the animal. But by contrast, it can cause severe gastro illness if it spills over to humans. And this can be complicated by hemolytic uremic syndrome, or HAS, which is a potentially fatal kidney disorder, particularly in vulnerable groups such as young children. For those of you from Queensland, you may recall there was an outbreak of STEC linked to the animal nursery at the ECA, or the Agricultural Show, in 2013. And that caused 57 confirmed cases of infection and 7 cases of hospitalization. So these are some more examples of zoonoses. The picture on the top right is of my great nephew undergoing the Great Australian Childhood Rite of Passage of having a photo taken with a carpet python at a zoo. And while many animal species shed salmonella bacteria in their feces, reptiles are especially high risk for shedding salmonella. So what my young nephew is getting is a salmonella necklace at the moment, in that picture. So it's really important that wildlife photo opportunities with reptiles are supported by good hand hygiene, because salmonella bacteria can sometimes cause really serious illness, particularly in young children. Now, with birds, I've listed psittacosis and influenza A viruses, but there are 2 other important diseases that are not zoonoses, but they are associated with work with bird droppings. And these are the fungal infections histoplasmosis and cryptococcosis, which are caused by fungi that live naturally in the environment. The fungi love to grow in soil that's enriched with bird, especially pigeon droppings. and in the case of histoplasmosis, also soil that's enriched with bat droppings. So these diseases, although quite rare, they do pose a risk to workers who disturb large accumulations of dried bird or bat droppings, especially workers who are immunocompromised. So how do zoonoses spread? Well, for any zoonotic disease to spread, there needs to be three links. First, there has to be a source of infection, so zoonotic bacteria, viruses, fungi, or parasites. There also needs to be enough of the infectious agent to initiate an infection. So every zoonotic disease has an infective dose, which is the amount you need to be exposed to for infection to occur. And for some diseases like Q fever, this is very, very low. It has an infective dose of between 1 and 10 bacteria. Secondly, there has to be a way of spreading. This is also known as the mode of transmission. And this is how an infectious agent gets from the animal to the person. And it includes contact, droplet, and airborne transmission. Some zoonoses also spread by foodborne transmission, such as listeriosis, but I won't be talking about that mode of transmission today. So each zoonotic disease has one or more preferred ways of spreading, which I'll look at in more detail over the next few slides. It's really important to know the mode of transmission for the zoonotic disease you're dealing with, because this determines the control measures. So if you don't know the mode of transmission, you won't necessarily know how to control the spread of infection. Now, thirdly, there has to be a susceptible person. That is someone who's able to be infected. Now, some people are more susceptible to infection, including the very young, the elderly, and people with certain types of chronic illness, such as diabetes or chronic respiratory or cardiac disease. Those who are immunocompromised, either because of a medical condition or because they're on immunosuppressing medication. And for some zoonoses, pregnant women may also be at increased risk, such as with toxoplasmosis. Vaccination reduces workers' susceptibility to infection, and it's a very important control measure for vaccine preventable zoonoses, and I'll talk more about this later on. So once you know the links in the chain of infection for the zoonotic disease you're dealing with, you can then select control measures that target one or more of these links. And this is because if you break a link in the chain, you can then stop the spread of infection. So it's all about trying to find the weakest link to target your control measures at. So the first mode of transmission is contact transmission, and many zoonoses spread this way. It's the most common mode of transmission. And this occurs when a susceptible person has contact with an infectious animal or its blood and body substances, maybe it's fleas or ticks, and contaminated fomite. So fomite is just the technical term for any contaminated item, such as contaminated surfaces or equipment. So following contact, the zoonotic agent can gain entry through the person's non-intact skin, for example, through a wound or dermatitis, through the mucous membranes of their eyes, nose, or mouth. And this usually occurs by touching the face with contaminated hands. It can also occur by accidental ingestion, usually by touching the mouth with contaminated hands, or through a penetrating wound, such as a needle stick injury or an animal bite. So examples of zoonoses that spread by contact transmission include cat scratch disease, which is an occupational hazard for those who work with cats, and rat bite fever, which is an occupational risk for those who work with rodents. So the control measures for contact transmission aim to prevent contact with a source of infection. So for higher order controls, this can include things like workplace or equipment or task design, such as separating out clean and dirty tasks and functions and equipment to prevent cross-contamination, or installing surfaces that are readily cleaned. Other controls include engineered safety sharps, such as retractable needles, and isolating sources of infection. Lower order controls for contact transmission can include good hygiene practices such as hand hygiene. This is one of the most important control measures for contact transmission, but it tends to be really undervalued. And as a health and safety inspector, it never ceases to amaze me just how inadequate hand washing facilities at some workplaces can be. Other lower order controls for contact transmission include covering cuts because non-intact skin provides a portal of entry, routine environmental cleaning, cleaning of blood and body substance spills, sharp safety, linen management, waste management, and sufficient PPE to protect against contact with the source of infection. And many of these control measures are getting plenty of airplay at the moment because the virus that causes COVID-19 spreads by contact transmission as well as droplet transmission, which we'll discuss shortly. So an example of a zoonosis that spreads by contact transmission is Australian bat lyssavirus. It's commonly referred to as ABLV. So this is a viral infection of bats. It's been isolated from all species of flying foxes and some species of microbats in Australia, but all Australian bats are considered susceptible to infection. Now, the prevalence of infection in bats is very low. It's commonly cited as less than 1% in free-living bats, but this can vary a little between bat species. However, the incidence does increase among sick, injured, and orphan bats, and this is the cohort of bats that is most likely to come into contact with people. So examples of at-risk workers include veterinary workers, bat scientists, wildlife and zoo workers, council workers who clean up bat carcasses, electrical workers who remove bat carcasses from power lines, and often there's a live pup still attached to its mum on the power line. Ecologists and others who have contact with bats at work. So human infection most commonly occurs by bat bites and scratches, and you can see from the image on the left of an anaesthetized bat just how sharp their teeth are. A problem is that these bites can then appear minor or even trivial, as you can see from the image on the right, but all bat bites and all scratches pose a risk of exposure to ABLV. Infection can also occur from contact between a bat's saliva or its neural tissues and a person's non-intact skin, or the mucous membranes of their eyes, nose, and mouth. For example, people who do taxidermy on bats or who dissect bats may come into contact with the bat's brain and spinal cord. And although the virus only survives for a short period of time on the bat's fur, it can survive indefinitely in its neural tissues, including after refrigeration and freezing. Now, Workplace Health and Safety Queensland tends to be involved with bat issues during extreme heat events. So flying foxes just can't cope with extreme temperatures, and this can result in the mass death of hundreds or even thousands of bats. And bat bites and scratches commonly occur during these events when people think that a bat is dead, but it's still clinging to life and may bite or scratch in self-defense if it's handled. So after exposure to ABLV, the virus travels very slowly to the brain to cause a rabies-like illness that's invariably fatal. And it can take between several weeks to even years for it to reach the brain. So there have been 3 known cases of ABLV infection in humans since the virus was first identified in 1996. Unfortunately, they all occurred in Queensland and they all involved fatalities. So ABLV is an example of a low likelihood but high consequence disease because it has this very, very high fatality rate. And as you can see from this image of the virus, it doesn't have a bullet shape for nothing. It's the ultimate hold no prisoners virus. So examples of control measures for ABLV, and again for contact transmission in this context, they include rabies vaccination. So there's no ABLV vaccine but the rabies vaccine provides cross protection because the two viruses are so closely related. But the bottom line is that no one should handle bats unless they've got current rabies immunity. And this includes having ongoing blood tests and booster doses of rabies vaccine to maintain immunity. Control measures also include safe bat handling methods, training and PPE, and hand hygiene and covering cuts to protect against inadvertent exposure to bat saliva. And having a bat bite or scratch protocol, it's really important that all bat bites, scratches, and other exposures, including to neural tissues, undergo proper first aid, no matter how trivial the wound. This now includes washing the wound for 15 minutes and then applying an antiviral antiseptic such as betadine. This is not a common inclusion in first aid kits, but it's really important for first aid kits where there's contact with bats. And then after applying first aid, the person needs immediate medical referral for rabies vaccination, even if they have previously had rabies vaccines, as they will require additional doses, just not as many as someone who's never been vaccinated against rabies, and they won't need the rabies immunoglobulin. As a health and safety inspector, I do continue to come across at-risk workplaces where they just don't know that a previously vaccinated person does need rabies vaccine boosters following a potential exposure. So a case study to illustrate ABLV is that Workplace Health and Safety Queensland prosecuted a bat scientist a few years ago for failing to manage ABLV risks. In this case, the PCBU directed non-immune workers and volunteers to capture and study wild bats for research purposes. None of the workers were provided with rabies vaccination, safety instructions, PPE, and there wasn't a bat bite or scratch protocol. Also, to fund the research, visitors, including tourists, could pay to have a pat and feed experience with captive flying foxes. Unfortunately, many of the workers and visitors got bitten and scratched, but they were not referred for medical attention. Now, fortunately, no one acquired ABLV infection, but people were exposed to a very significant level of risk. In this case, the PCBU got a 12-month good behaviour bond and had to pay court costs. Now, the next mode of transmission is droplet transmission, and some zoonoses spread this way. It occurs when infectious droplets are deposited onto a susceptible person's face. It usually involves droplets of blood and body substances, such as respiratory secretions, but for some zoonoses, it may include other substances, such as contaminated water. The infectious agent then gains entry through the mucous membranes of the eyes, nose, and mouth. Now, zoonoses that spread by contact transmission also usually spread by contact transmission. And that's because when the droplets are deposited out of the air, they can then contaminate surfaces which people may touch. So examples of zoonoses that spread this way include leptospirosis and hendrovirus. So the control measures for droplet transmission aim to prevent droplets from being deposited on the mucous membranes of the eyes, nose, and mouth. So examples of higher order controls can include workplace equipment or tasks designed to minimize the generation of droplets. For example, not using water under pressure for cleaning, using barriers and screens to contain droplets, and physical distancing to isolate people from the source of droplets. And lower order controls can include PPE to protect the mucous membranes. So an example of a zoonosis that spreads by droplet transmission is leptospirosis. It's also spread by contact transmission, and it's caused by bacteria called Leptospira. And there are many different serovars or strains of the bacteria which preferentially infect different animal species. So a number of animal species can be infected with leptospirosis, but most human infection occurs from cattle, pigs, and rodents. And this occurs from exposure to their urine or water that's contaminated with their urine or exposure to their birth products. The bacteria then gain entry through the mucous membranes and non-intact skin. And as you can see from the image, the bacteria have a corkscrew shape, and this allows them to very efficiently gain entry to the body, just like a corkscrew twisting its way through the cork of a wine bottle. So examples of at-risk workers include cattle and pig farmers, abattoir workers, sewage workers, outdoor water activity workers, banana farmers, horticultural workers, pest control workers, and many, many more. That's just a representative list. So what does leptospirosis do? Well, it causes an influenza-like illness, which in some people can be quite severe. So about 10 to 15% of people progress to severe disease requiring hospitalization and often intensive care. So examples of life-threatening and illness and fatalities that Workplace Health and Safety Queensland has investigated have included illnesses at banana farms and outdoor water activities like whitewater rafting and swiftwater rescue train, where there's been contact with rodent urine. Last year, WorkSafe New South Wales investigated a cluster of cases at a berry farm, again where the source of exposure would have been rodent urine. So control measures for leptospirosis include things like stock management and biosecurity to prevent the introduction and spread of infection at properties. So that includes things like placing newly acquired livestock into quarantine, vaccinating livestock, although this doesn't protect against all serovirus, keeping cattle and pigs separate to prevent the cattle being infected with pig serovirus and vice versa, feral pig control and veterinary management of the animals. For other higher order controls, it includes things like isolation and engineering controls, so using screens and shields to contain droplets, using drainage to help prevent the buildup of stagnant water and animal urine that may become a source of droplets, washing up, so hand hygiene, showering, cleaning up, keeping the workplace clean to discourage rodents and cleaning up animal urine, drying up. This is really important because the bacteria that cause leptospirosis, they readily survive in wet environments, but they quickly turn up their toes and die if they are dried out. Also covering up to protect against exposure to animal urine and birth products and potentially contaminated water and soil and vegetation. Rodent control and information and training. Now, information and training is always important for any hazard, but it's particularly important for, whoops, got too fast, sorry. Back slide. So it's particularly important for zoonoses, for lepto, because it does cause this influenza-like illness. And so people, if they don't know that they may be at risk of exposure to lepto, if they get a influenza-like illness, they may not seek medical attention because they know that you can't get antibiotics for the flu, whereas lepto is fully treatable with antibiotics. So as an example, Workplace Health and Safety Queensland investigated a case where a worker was at risk of lepto from outdoor water activities, but the PCBU hadn't identified it as a hazard, even though it was readily foreseeable. And unfortunately, this is not an uncommon occurrence. So the worker became sick and presented to hospital and to the A&E department. He was told he probably had the flu and he was sent home with 2 paracetamol. 48 hours later, he was in intensive care and he did survive, but he survived only by the skin of his teeth. It was a really close call. And his lack of knowledge and information about his leptospirosis risk possibly contributed to the delay in his diagnosis and treatment because he wasn't able to have that conversation with the medical staff about his work and his exposure risk at his workplace. Now, for more information about leptospirosis, I really recommend the WorkSafe New Zealand publication, which you can see in the image. And this discusses industry-specific controls for quite a wide range of different industries. It's a really, really good resource. So a case study to illustrate leptospirosis is that Workplace Health and Safety Queensland investigated an incident that involved a horticultural worker who was hospitalised with severe disease. Again, horticultural work poses a well-recognised leptospirosis risk because rodents are attracted to the produce, but it's not always well recognised at a workplace level. So on investigation, the PCBU was totally unaware of the leptospirosis risk. They had never identified it as a potential risk for their workers. The worker had recently cleaned out a shed where there were nesting rats. He used high pressure water to clean the shed, which would have exposed him to droplets. He also had an uncovered scratch on his leg, and with lepto, that's all it takes for the bacteria to corkscrew their way in. You don't need to have a significant wound. And he didn't wear any PPE or wash his hands after completing the work. Fortunately, he survived, but he was really unwell at the time. So the last mode of transmission is airborne transmission. Now, only a few zoonoses spread this way, and this occurs when a susceptible person inhales infectious aerosols or dust. So some examples of zoonoses that preferentially spread by airborne transmission include Q fever, psittacosis. This is a disease of birds, particularly birds of the parrot family, which can cause a really severe pneumonia in at-risk workers, and also anthrax. So control measures to prevent airborne transmission aim to prevent inhalation of infectious aerosols and dust. So examples of higher order controls can include workplace equipment and task design to prevent the generation of aerosols and dust suppression and ventilation controls, and lower order controls can include a fitted particulate respirator. Now, the science behind droplet versus airborne transmission is not always clear-cut. Some zoonoses that spread by droplet transmission may have an element of short-range airborne transmission. And so it's important to adopt the precautionary principle, especially for high consequence diseases or for new zoonoses where the scientific knowledge may be incomplete. Also, some zoonoses that spread preferentially by droplet transmission in nature may have the potential to spread opportunistically by short-range airborne transmission, especially during work activities that create aerosols of infectious substances, including some types of veterinary procedures. So an example of a zoonosis that spreads by airborne transmission is Q fever. This is the most commonly notified zoonotic disease to Workplace Health and Safety Queensland, even though it's completely vaccine preventable. It's a bacterial infection caused by Coxiella burnetii bacteria. I commonly hear it being referred to as a viral infection, but this is not correct. It's an important difference. It's not just me being pedantic, because unlike viral infections, Q fever is treatable with antibiotics. And again, that early diagnosis and treatment can help prevent progression to more serious illness. As you can see from the map, Q fever is particularly prevalent in Queensland and New South Wales and the Northern Territory. So many different animal species can be infected with Q fever, but most human infection is caused by cattle, sheep, and goats. Infection can also occur from native wildlife, particularly macropods, which are your kangaroos and wallabies, but also bandicoots. So at Workplace Health and Safety Queensland, we've seen a slow but steady increase in Q fever notifications associated with macropods. For example, people mowing or working in areas with dense kangaroo populations. Other at-risk animals include the camelids or the camel family, as well as dogs and cats, but particularly prurient or birthing dogs and cats. So examples of at-risk workers include abattoir workers, pet food manufacturing workers, farmers, livestock transporters, wildlife workers, vets, and veterinary nurses, professional dog and cat breeders, and many, many more. It really impacts on a very diverse range of industries. But again, often those industries have not identified Q fever as a hazard for their workers. Now, with Q fever, when it infects animals, they usually don't show any signs of illness, but they do shed the bacteria in their urine, feces, and milk, but in especially high numbers in birth products. So, birthing and aborting animals are particularly high risk. After shedding, the bacteria can survive in the environment for prolonged periods, months to years, and they're resistant to harsh environmental conditions. So that can mean that if livestock have been grazing on land and that land is now no longer used for livestock grazing and may be used for another purpose, there may still be Q fever bacteria in the soil. So what happens if you get Q fever? Well, human infection first occurs by inhaling infectious dust and aerosols. So, for example, when assisting with birthing or cleaning animal housing. Less commonly, infection occurs from drinking unpasteurized milk and from tick bites. So about 60% of people don't get sick at all when they get Q fever, and the time they know they've been previously infected is when they undergo Q fever screening. Of the 40% of people who do get sick, this ranges from a mild flu-like illness through to a severe disease with complications such as pneumonia. What makes Q fever such an important disease is that about 15 to 20% of people develop post-Q fever fatigue syndrome. And this is a condition where people continue to feel unwell for 12 months or more after their initial infection. It's very, very debilitating and can significantly impact on a person's successful return to work. It can also lead to common law cases. About 3% of people develop chronic Q fever, and this is a condition where the bacteria continues to replicate. It's not suppressed by the immune system, and it causes ongoing infection. It most commonly presents as endocarditis. This is a serious condition causing infection of the heart valves. It can also present as an infection of the bones and joints. I've recently been involved in a Q fever investigation where a worker had serious chronic infection in their spine, requiring major surgery and prolonged rehabilitation. Some people are more likely to develop chronic Q fever after they've been infected, and this includes people who have pre-existing heart valve disorders or who are pregnant at the time they're infected or who have a weakened immune system. For pregnant women, there's also an increased risk of complications affecting the baby, including miscarriage, stillbirth, premature birth, and low birth weight. So it is a serious disease. Vaccination is the single most important way to protect workers, but as a health and safety inspector, I continue to see workplaces where at-risk workers remain unvaccinated and are at significant risk of infection. Supporting control measures include dust and aerosol management, for example, dust suppression in stockyards. You can see from this image just how much dust can be generated from livestock movement. This is a workplace I investigated where a number of workers acquired Q fever. Also, ventilation controls and cleaning methods that minimize aerosols and dust. And a fitted particulate respirator can be used as a short-term control, but it's never a substitute for vaccination. So an example of a case study involving Q fever, this is one that a colleague of mine investigated. It was a complex investigation, and it's unusual in that most of the Q fever incidents the Workplace Health and Safety Queensland investigates are linked to livestock or macropods. In this incident, there was a cluster of Q fever cases at an animal refuge, and this affected 5 animal attendants, a vet, and a veterinary nurse. 2 of the workers were hospitalized because they were so sick. The likely source of infection was a cat that had aborted her litter. None of the workers who assisted the aborting cat were Q fever immune. There were no ventilation controls, and none of the workers wore respiratory protective equipment. There was also a very low level of knowledge about the Q fever risk from parturient dogs and cats. And we now have a fact sheet on our website about dogs and cats. So I've already discussed vaccination in the context of Q fever and rabies or ABLV. Only a few zoonoses are vaccine preventable. Vaccines don't eliminate the hazard because not all vaccines work 100% of the time in 100% of people, but they are an important engineering control because vaccines are engineered substances. In addition to Q fever and rabies vaccination, it's also important that those who work with pigs and poultry have seasonal influenza vaccination. Now, this won't protect them against infection with zoonotic strains of influenza A viruses, but it will help prevent concurrent infection with both human and zoonotic strains, which could make a worker especially sick. Vaccination is also important to prevent those who work with pigs from spreading human influenza A viruses to pigs, which are susceptible to human influenza A viruses. So this is a case of reverse zoonoses. So in pigs, human influenza A viruses can cause significant morbidity and reproductive loss, and this in turn can have significant economic impact for the producer. There's also the potential for infected pigs to spread human influenza A viruses back to people. There's also a risk that human influenza A viruses could undergo change in a pig host, especially if the virus has the opportunity to mix with other influenza A viruses. Now, pigs are well recognized mixing vessels for flu viruses and a source of pandemic influenza viruses. I think we've got enough on our plate with COVID-19 at the moment without a new pandemic strain of influenza A virus to add to the mix. So that vaccination is just so important. But again, as a health and safety inspector, I'm finding a low level of awareness among pig and poultry producers and workers about seasonal vaccination of their workers. And now some vaccines have a human health benefit in that by preventing animals from becoming infected, the spread of infection to people can be minimized. This includes Hendra vaccination of horses, Leptospirosis vaccination of cattle and pigs, and anthrax vaccination of sheep, cattle, and pigs in at-risk areas. Now, anthrax is fortunately a very, very rare disease in Australia now, but there is an anthrax belt that runs from the lower end of Queensland all the way down to Victoria. You can see it on the map there. And this belt follows historic mustering routes from a time when anthrax was prevalent in livestock. Anthrax spores may still be present in the soil in these areas from animals that died decades ago from anthrax. When you get extreme weather events or soil disturbance, this can release these historic spores and cause anthrax in livestock that have contact with that soil on those properties and potentially expose livestock workers and vets to risk. So in Queensland, recent anthrax incidents have occurred in the St George Dirrabandi district, and PCBUs of properties in this area should talk to their vet about vaccination of their livestock. Now, I'm going to finish up by looking at COVID-19. Now, there's so much information available. It's information overload at the moment, and you are probably already across much of it. So I thought I'd take a different angle and look at its role as a zoonotic disease. So COVID-19 started as a zoonotic spillover event in late 2019 when the virus that causes it jumped from an animal into a human, but it's now a human disease. It's no longer a zoonotic disease. The virus is likely to have originated in bats because coronaviruses are known to be widespread in global bat populations where they cause infection in the bat, but not disease. But having said that, it's really important to note that although some strains of coronaviruses have been found in Australian bats, there's no evidence that Australian bats cause the coronaviruses associated with SARS, MERS, or COVID-19. Now, it's not clear whether the spillover event that allowed the COVID-19 virus to jump to humans occurred directly from a bat to a human, or whether it occurred via an intermediate host. So animals such as pangolins have been suggested as a possible intermediate host. With SARS, it was civet cats, and with MERS, it's dromedary or the one-humped camels that are considered the intermediate host. So a question that health and veterinary authorities are considering at the moment is, can SARS-CoV-2 infect pets? Well, the answer is yes, but this comes with a very big but, and the risk needs to be very carefully placed in context to avoid unnecessary alarm or animal welfare issues, such as people abandoning their animals. So far, there's been 2 dogs in Hong Kong whose owners had COVID-19, and the dogs have tested positive for the virus, but they remained healthy. More recently, a cat in Belgium and another in Hong Kong, again, whose owners had COVID-19, have tested positive. One of these cats had a transient respiratory and gastrointestinal illness. A recently released but not yet peer-reviewed study out of Wuhan in China found a sample of cats to be seropositive for the disease, indicating past exposure. And as you'd be aware, a tiger at the Bronx Zoo in America has now tested positive. A recently released but not yet peer-reviewed article has described a small COVID-19 transmission study of animals, and I've included a link to that study in the reading list. And it's demonstrated that ferrets and cats are susceptible to infection, that dogs have low susceptibility, and pigs, chooks, and ducks are not susceptible. So this means the risks are presumably greatest with cats and ferrets, if pet ferrets are your thing, but the risk from dogs is probably pretty limited and short term. There has also, I'll just move on. But yeah, this is a rapidly evolving situation, and this information is likely to change over time. So the next question is, can infected pets infect humans? Well, again, the big question, and to be honest, no one really knows. There's currently no evidence that infected pets can spread the disease to people. But again, it's an evolving situation. Infected people remain the biggest risk for spreading infection, not their pets. So people shouldn't be unduly worried about catching the virus from their dog or cat, because it's pets that are far more likely to be infected from their owner rather than the other way around. And no, your pets don't have to wear PPE. So how should dogs and cats from households with infected people be managed? Well, Biosecurity Queensland is going to be developing resources on this issue. But at the moment, the main goal is to try and reduce the animal's contact with other people and other animals and other environments. So in an ideal world, infected people should limit contact with their pets if possible. However, this needs to be balanced against the role that pets play in providing companionship and reducing anxiety, especially when there's currently no evidence of pet to human transmission. Pets from infected households should be kept at home, not allowed to wander, and should be kept away from other animals to avoid infection tracking out of the home. So no doggy play dates if their human owners are infected. So isolation should apply to the whole household and not just to the infected humans. People in infected households should adopt good hygiene around pets and when cleaning up their feces. So the study I referred to before demonstrated viral RNA, but not live virus, from the rectal swabs of experimentally infected cats, and to a lesser extent, dogs. Pets from infected households should be kept away from people who are at increased risk of severe disease, such as those with underlying medical conditions. And if the animal needs veterinary attention, to make sure the vet knows about the household infection so that they can take appropriate precautions. But for households where there is no COVID-19 infection, it's really business as usual. There's no increased risk. But it's common sense to always maintain good hygiene around pets and around their body substances, including their feces, because they may have other zoonoses. So the take-home message for now is that you need to worry more about your human contacts than about your pet contacts. However, it does make sense to take simple steps to protect pets from infected people and to keep exposed pets from infected households away from other people and other pets. But to keep the risk in context, the main risk to human health is from contact with infectious people. So that's all I'm going to say for now. Thank you so much for the opportunity to talk to you. And so the question I've got is around Q fever and ticks. So the Q fever is only very rarely spread from tick bites, and ticks can spread the disease between animals in nature. So, for example, ticks can spread Q fever infection between kangaroos in nature, and those same ticks can then spread infection from kangaroos to livestock. So it's the ticks that normally infect livestock or normally infect macropods, which are the risk to human health. But again, to put it in context, most Q fever infection occurs from inhaling infectious aerosols and dust, and tick bites are not considered to be a significant source of human infection. Over to you, Zach. Oh, another question. Speaking of ticks, does Lyme disease exist in Australia? The research, as I understand it, is no, but there may be similar illnesses that cause a Lyme-like disease in people. But it's a complex question. But the current medical opinion is that Lyme disease does not exist, but there are many people out there who have health issues and who believe that they do have Lyme disease, but probably possibly the true answer is that it may be another illness that is Lyme-like, but it is a question that is still unanswered. Any other questions? Okay, I'm going to pass over to Zach now.
Dust, soil for things like
I can't answer that question because I'm not sure how much that you could do. I haven't been asked that question before, I'm sorry. But certainly it's very readily tested in livestock and humans.
presentation. Very interesting. I haven't sat through a training session from Trish for a very long time, and it's well overdue. What I'd like to direct your attention to is to a poll I'll just be putting up about our future virtual sessions until other advice is found about face-to-face meetings. And the other thing I want to just point out is in your handouts tab next to the polls is the resources that Patricia has put up for you as well. So I'd just like to thank you all for participating in today's session, and hopefully see you all again soon in one like it. Thank you.